The right amount of alcohol-based hand sanitizer that you use to perform hand hygiene is very important. Think of it as a dose, much like a medication. Imagine that you have an infection and your doctor has prescribed an antibiotic twice per day to treat the infection. You do not read the doctor's instructions carefully and instead you take the antibiotic once per day. You may receive some benefit from taking the antibiotic once per day, but you may not be achieving the desired efficacy that your doctor intended. The same is true of alcohol-based hand sanitizers. Manufacturers of these products should specify the right amount or right dose of product that is needed to achieve acceptable antimicrobial efficacy. The GOJO LTX and ADX dispensers and 354 ml and 535 ml bottles release at least 1.1 ml of PURELL Advanced Hand Rub, the amount needed to achieve a 3-log reduction with repeated use, so you can be confident that you're getting the most efficacious amount of product with each hand hygiene event. The importance of using the right dose can be demonstrated in the laboratory. In this first picture, a laboratory worker with hands contaminated with the bacterium Serratia marcescens placed his hands on an agar petri dish that allows bacteria to grow and be visualized. You can see the heavy contamination of Serratia from his hands, which appear red in color. The laboratory worker then used 0.6 milliliters of PURELL Advanced Hand Rub, which is an incorrect dose, roughly half the amount of product that is actually required. He then placed his hands on another petri dish. You can see that many bacteria remained on his hands even after using PURELL Advanced Hand Rub because he did not use the right amount of product. In this next example, the laboratory worker contaminated his hands again with Serratia, using the same technique, and placed his hands on the petri dish. As you can see, the agar is heavily contaminated with Serratia, much like in the last example. He then used a 1.1 milliliter pump of PURELL Advanced Hand Rub, which is the amount needed to achieve a 3-log reduction with repeated use. After using the correct amount of product and correct technique, you can see that very few colonies of Serratia remain, and the white colonies of bacteria that remain visible are normal, healthy bacterial flora of the hands. But you can see the dramatic difference between using 0.6 milliliters and 1.1 milliliters. Just like a medication, it is critical that you use the right dose of alcohol-based hand sanitizer in order to achieve the desired outcome, which is adequate reduction of germs on your hands.